Disparities of Dementia. So this presentation is supported by the CDC, also the U.S. Department of Health, and Us Against Alzheimer's. So I was a fellow for Us Against Alzheimer's. So this is one of my favorite topics because I work primarily with older adults, and currently I care for someone who has Alzheimer's disease at the end of life. So our objectives for this evening are we're going to describe Alzheimer's related disparities, recognize risk factors, and identify risk reductions for Alzheimer's disease, which is some new evidence that has come out. I think it was some things that we talked about, but more things that we can put into the forefront to work with the communities that we serve to help do more on the preventive end of dementias. So I have a question, and some questions, and you can put them into the chat because I just like to find out these types of things. I'm a busybody. Um, if you're caring for someone with dementia, put a 1 in the chat for me. If you know someone caring for someone with dementia, put a 2 in the chat for me. And if you think you're at an increased risk for dementia, put a 3 in the chat for me. So if I was to be in the chat, I would put a 1, 2, and a 3. I care for someone with dementia. I support a lot of people that care for people with dementia. And do I think I'm at an increased risk for dementia? I do, because I've had people in my family that have had dementia as well. So in talking about the aging brain, we know that our brain ages, we have a lot of shrinkage, we start to lose some things, our wisdom gets better, our expertise gets better, but our memory and some of the other things that we have that may diminish. And also how quickly we respond to things. I know for a fact that in my younger days, I was very quick with a comeback, very quick with the answer. Now it takes me a little bit more time to think about it. That may be wisdom, but it's also that maybe my brain doesn't move as fast as it used to. And some forgetfulness is okay, but memory loss is not a normal part of aging. My great grandfather, who was an unbelievable man, he lived to be about 106, and he was still telling me stories about himself up until right before he passed away. Very, very clear about all of the things that happened to him during his lifetime. So when we think about dementia is a term that's used to describe cognitive problems. And we hear it thrown around so much that it really does confuse the community. It's an umbrella term for memory loss, and the ability can be severe enough. A loss of abilities can be severe enough to interfere with the person's daily living. So Alzheimer's is the is the largest number of people that we hear with dementia. That's 60 to 80%. Lewy body is anywhere from 5 to 10%. Vascular is 5 to 10%. And we see that a lot in African Americans because African Americans have a high incidence of hypertension. They have a high incidence of stroke. And that is one of the reasons why we see a large number of vascular dementia in African American populations. Frontal temporal dementia, 3 to 10%, and then the others 3 to 10% in those. And then it's always a mixed dementia. Also, let's also keep in mind that when we're looking at dementia, it's important that we get the patient to the right specialist. not only the right neurologist, but also the right psychologist, because we also have to keep in mind that it may be more than just a dementia diagnosis. It may be a mental illness diagnosis. So it may be a dual diagnosis, and the behaviors that we may see may not necessarily all be dementia. When we're talking, since Alzheimer's is the most common, we need to understand that it's irreversible, it's a progressive brain disease, and it slowly destroys memory, thinking skills, and the ability to carry out basic functions. The brain changes can begin even 20 years before any noticeable symptoms. That's, when we think about it, they always, if you recall, they used to say that hypertension was the silent killer because you didn't know that you had any problems until later. But when we think about it, Alzheimer's, if the brain changes starts 20 years before we notice anything, that's almost like a silent killer as well. Black and Latino people experience more mixed dementia than white people. And in some studies that have come out recently, they're saying that Black and Latino population, people of Black and Latino population are being diagnosed later. And we'll have an opportunity to talk about that. So some early signs of Alzheimer's: memory loss that disrupts daily life. I'm going to give some examples of my family because I have their permission and because I just wanted to hit home. So I have my aunt, she's one of my favorites. And because she was always so poised and could change a conversation very easy, it was very difficult for people to see that she had early signs of Alzheimer's until her niece came in, and that was me. So I could very easily tell her children, your mom is changing. And they said, well, what makes you say that? And I was like, well, um, she came out of the house with no makeup on, or she has all of her things stacked up in one area, which is very different for her. So it was very small things that I saw that her kids didn't necessarily pay any attention to. Challenges in planning or problem solving. Remember, Alzheimer's affects executive thinking. So when you have a person who can do multitask, do all of these things, and then they can't keep a doctor's appointment, that's a big indicator. Or if they go out to the store, they'll come back with the same 5 items, whether they need them or not. That lets you know that it's a big change in them. Difficulty completing familiar tasks like writing out their bills, mailing letters. For my aunt, it was dialing the telephone. She had a push button phone. Older people, even now, keep a house phone. She had a cell phone. At one point, she couldn't even use the cell phone anymore, but even her house phone, when you would call, you'd say, well, I called you and left a message. Why didn't you call me back? And she was like, it's something the matter with your phone because I couldn't get the number to go through. Confusion with time and place where they are. I took care of a lady one time, and she says, I'd like to go for a ride. So I put her in my car. I live in DC, took her for a ride. And when she was looking out the window, she said, Alabama sure has changed, because she thought that she was in the home of her childhood. Trouble understanding visual image, and judging distance. This is really, really important. Patients that have Alzheimer's have a lot of visual problems. So things might look like they're very close up when they aren't. They may look like things are very far away when they aren't. So this is why they have a lot of falls. This is why they bump into a lot of things. This is why when it's a lot of crowds, they get very discombobulated about where the placement of things are. And that's why they like for things to be in places where they've always been, because their visual acuity is not the same. More and more, you'll see when you take them to the eye doctor, at some point, they're not even able to do the exam anymore because they can't look into the machine. They may not be able to see the letters or any of the things that's being put before them. Um, they have new problems with words in speaking and writing. It's one person that I care for that's a professor, and she's one of the most brilliant women I've ever met, but she can only speak in very simple terms now. And if I was to say something, if she was to repeat it, she couldn't repeat what I said to her. She hears what I said because her hearing is fine. She's just not able to repeat it. Increasingly misplacing things or losing the ability to retrace her steps, and being very agitated about it too, thinking that people have moved things or taken things. Decreased poor judgment, and not necessarily because of their attitude, because they don't recognize the dangers, partially because of their visual acuity. The other, just safety in and of itself, not realizing that their memory isn't good anymore. So for cooking, even for taking a bath, not realizing how hot the water is. They may need assistance in, just even if they can wash themselves up, they may still need someone to get the water temperature correct, because they don't have the ability to judge sometimes how hot the water is going to be. Withdraw from work or social activities. Part of that is because they have a hard time keeping up with conversations. The patient that I care for now, when all of her family is around, which she absolutely loves, I'm the liaison. So I'm telling her what everybody is saying because the conversation is going too quickly and she wants to be involved. So if you're at work and all of these things are going on, the phone is ringing, people are asking different things, they can't keep up with it. And same in a social setting. And it's is agitating to them. And it's also, I think, kind of hurtful too. Also changes in mood and personality. Now, the lady that I care for now is a joy, but I've had some patients that weren't. Um, they knew that their memory was not that great, but they were annoyed all the time because they just couldn't remember and they wanted to be independent. So when we're looking at the stages of cognitive impairment, these are the four stages that physicians may or other practitioners may stage the patients at: mild cognitive impairment. They forget information and appointments, and they have trouble making good decisions. And I just want us to think about, so in that case, like patients who say, "Oh no, I'm not going to take my medicine because I'm not going to take it today because it makes me pee too much." Is little small things. It may not be something that's done every day, but it is something that lets you know that this is something different from what they used to do. For mild Alzheimer's, the memory loss of recent events, asking the same question over and over. What did you say? Not that they didn't repeat you, because I want us to remember that they have difficulty understanding language. So a lot of times when they ask you, what did you say? It's not their hearing. They want you to repeat what you said because they're trying to understand language, words. Um, Coming up with a correct name or correct word, trouble problem solving. They'll either keep going at it until they try to do it, until they can figure it out, or just give up on the whole thing. Example, you come in and you see a piece of machinery completely taken apart, and the only thing that it needed was some batteries because they just could not figure out how to get the thing to work. Personality changes. You will see that. And remember, some of the personality changes may be because of a dual diagnosis. Some of it may be from Alzheimer's, some of it may be from something else. Expressing and organizing thoughts, uh, and also expressing and organizing tasks. An example, putting your underpants on over your pants, forgetting the rhythm and the way that things go. For moderate Alzheimer's, poor judgment, worsening confusion, forgetting the day of the week or the season, greater memory loss, like not knowing your address or your phone number or your birthday or your social security number. Need help with daily activities, and you may be incontinent, and you may have significant, excuse me, significant behavioral changes, and you may wander. These are the people that we may have wander guards on. The other thing is, the good thing about an Apple Watch or the new electronic watches is that you can track the person, and they have the ability to let you know whether or not they've fallen as well. The Apple Watch does. And then stage 3, they lose their ability to communicate. They can no longer speak. They require daily assistance. Their physical ability have decreased, and they probably aren't eating as much. Also, you'll see an increase in urinary tract infections, also pneumonia, and depending on if they have advanced directives in place, other problems, because a lot of families may opt to put a feeding tube in. Now, while we're talking about advanced directives, I think that it's important that when we have a person that has a new onset diagnosis of dementia, that we really start to talk to them and their family about advanced care directives. And the rationale is we don't know we don't know how long the person is going to be able to make good decisions independently. So it's important that they have someone that they want that's in line with their culture and values to make decisions for them when they're no longer able to make decisions for themselves. And when we put it that way, I think it makes it easier for the person. Not telling them, well, you're going to die, but this is for you. This is so that all of your wishes will be managed the way that you want them to be managed. Now, disparities and health equity. So in regards to Alzheimer's, is about 6.9 million older adults. 1 in 9 age 65 and older have Alzheimer's. Almost 2/3 of Americans with Alzheimer's are women. I don't think I knew that. And now I'm more hyper alert about what it is that I need to do to stay on the lower risk end of developing Alzheimer's. Because what I also learned was that if you're of high intelligence, I don't know how true it is. I read it in an article that you're at a higher risk. Now, I'm not the smartest thing in the world, but if you're a little bit smart and it increases your risk, I think I better try something on the other end to decrease my risk. In 2019, Alzheimer's disease was the 6th leading cause of death for all adults. And when COVID became the 3rd leading cause of death, Alzheimer's disease became the 7th leading cause of death. So it's the 7th leading cause of death in all Americans. For African Americans, it was the 6th leading cause of death. And for Latino Hispanic Americans, it was the 5th leading cause of death. So the percentage of older adults 65 or older with Alzheimer's by race and ethnicity, so it was 19% African American, 14% Latino, and 10% non-white Hispanic. So by 2030, nearly 40% of Americans living with Alzheimer's will be will be Latino or African American. And that was a shocker to me as well. This came out during a 2019 Us Against Alzheimer's event. And part of it has to do with all of the risk factors that African Americans and Latino have that increase their risk for Alzheimer's disease. So African Americans are 2 times as likely to have Alzheimer's, and less likely than white patients to receive a timely diagnosis. Let's talk about that for a little bit. You know, we have families, they come in, they have a little bit of memory loss. They may or may not say anything about it. They don't talk about Alzheimer's like they don't talk about a lot of other diseases. So if they are experiencing something, they aren't necessarily upfront with the providers. They're more likely to report experiencing racial discrimination along with along the patient and caregiver journeys. I know people who have said that. They've had problems not only trying to get the diagnosis correctly, but also getting resources put in place. More recently, in the last 40 days, I had a friend call me to tell me that her family member's physician did not want to tell the patient that she had Alzheimer's disease because she felt like it was going to make the patient decline. However, the family is trying to run in circles to try to put all of these things together to support the lady. The lady realizes that it's something wrong. She doesn't know what it is, and she's refusing help from her family. Why not just tell the lady what her diagnosis is? Latino people are 1.5 times as likely to have Alzheimer's and less likely to be enrolled in a cutting-edge Alzheimer's and brain health research. Now, I'm interested to find out why we feel Black and Latino families are not, or patients are not being enrolled in brain health research. Does anybody want to put something in the chat? I know from my own experience, from what patients tell me, they they well, what one family told me was that um that by the time that they were diagnosed, they weren't eligible for any brain health research. Another family member told me that they only want that the researchers were only looking for patients that had mild dementia when sometimes the people were already far more advanced. So I'm going to just take a look in the chat and see what you have to say.
Well, Dr. Gibson is on the line,
Yeah.
who
Yes.
does clinical research in
Yes.
Alzheimer's.
Yes. Dr. Gibson, chime in, please.
And I just came from the Alzheimer's Association meeting. Um,
Mm-hmm.
and so I'm only going to say it very quickly,
Okay.
but the community wants to be a part of Alzheimer's research. And
Mm-hmm.
so um, we just need to ask, right?
Mm-hmm.
Um, and so a little bit later, when you're done with your presentation, we can talk about that, how we can get people in Black and Brown communities to participate in clinical research. We can talk about that.
Yeah, that'd be great. I recently did a recently did a focus group with caregivers of patients from Alzheimer's across the country. And every single person on the focus group said that they were interested if they could get their person in a study, they would.
Yes.
Every single person said that they would. So I agree. So when we're so I'm going to keep going.
Keep going, and when we get to the end, I'd be happy to talk about it and talk about what the Alzheimer's Association has been talking about this week.
Wonderful, thank you. So, for the health disparities for Alzheimer's in the Latino community, they're 10 times more likely to have a stroke, 20 times more likely to be obese, 22 times more likely to have poorly controlled blood pressure, and 63 times more likely to be diabetic. So by 2060, it's expected that 3.5 million Latino people will be living with Alzheimer's disease, with a growth of 832%, which is just blows my mind. Latino families are less likely to use formal care services like nursing home care and hospice care. So 46% of white people over age 55 have been told by their physician that they had a memory-related disease, compared to 34% of Latino and 34% of African Americans. African Americans and Latino people with Alzheimer's are less likely to be told their diagnosis or to have their physicians raise or ask questions about their brain health. And, that's something that we can talk to our patients about. That when they go in for their physical to their primary care physician, that they can just ask that one question along with any of the other questions when they go in prepared with a list of questions. How's my brain health? If it's something that they're concerned about. When 80% of Black people surveyed over the age of 50 say brain health has never been discussed by their physician. So, what can we do for modifiable risk? This is one of the things that I loved about it. Just recently, some research came out, probably like in maybe the last 6 months, from Alzheimer's researchers, about lifestyle factors, that really hit home in regards to Black and Latino populations decreasing their risk of Alzheimer's disease. And you know what? It has everything to do with the other comorbidities that we're trying to manage in African American and Latino population. So, and I'll start with the ones that we know the most. Hypertension. If we can decrease their hypertension, their obesity, their smoking, their diabetes, their excess alcohol, those will absolutely decrease their risk in Alzheimer's disease. Hearing loss. Hearing loss has a lot to do with how dementia plays out in a person. Depression. Depression can look like dementia, and dementia can look like depression, which is why you have a neuropsychologist or a neuropsychiatrist to treat the patient to see whether or not it's one or the other or both. Also, someone with a head injury and air pollution. All all of these decrease, making a change in these will decrease the risk of Alzheimer's disease. If we increase quality education, you know what? It's a stigma with talking about Alzheimer's disease. And for the life of me, I can't figure out what all of it is, especially in the Black communities, because I've asked just straight out. I've talked to groups of families, groups of caregivers whom I love to support and say, why don't you talk about it? and they say they just don't. Also physical activity, getting people to move. And I don't know what that moving is. When I talk about exercise and things like that, they say that they're not interested. But I told a group of patients recently, excuse me, I said, you know, what I do is put on 15 minutes of trap music every morning and just shake until I'm worn out, and then I get in the shower. That's some type of activity. So if I get a chance to go out and walk, it's great. But if I don't, I know that the rotations per minute in trap music is pretty fast, and that will increase my heart rate. And then social activity, um, meeting with people. And I know that was tough during COVID, but with Zoom and FaceTime and everything else, we still have the opportunity to connect with people to keep their brain moving. So to help patients reduce their risk of cognitive decline, neurovascular risk management, all of the things that we just talked about, physical activity, movement, good circulation to your brain, sleep. Sleep is so big. You really have to have that 8 hours to shut it down. No TV, no cell phone, not any of that. Just so that your mind can rest, because you can lose weight. All of these different things happen when you're sleeping. Nutrition. It helps with not only the obesity, but also getting the proper nutrients to your brain. Social activity. Uh, Greeting, meeting, um, helping with your vocabulary, all of those things, keeping them fresh and astute. And then cognitive stimulation. One is a gentleman that I know right now, him and his sister. He's in Florida, she's in California. They talk every morning because they both do New York the New York Times crossword puzzle every morning. So it's things that the patient can is things that we can talk to the patients about doing, because the Alzheimer's is just one more disparity that's added into the hat of all of the other things that we're trying to manage for Black and brown populations. What nurses and other healthcare providers can do, um, manage and establish hypertension and type 2 diabetes with appropriate medication. We've talked to our patients about this, but you know what? One of the things that I've learned is that try to ensure that the information that I'm giving to them is on a literacy level that they understand. When I have a patient that keeps coming back and coming back, and they're coming faithfully, but it's a piece of something that's just not right, it usually has to do with how well they understand the instructions. Because you know what? Healthcare is complex. It's a lot that has to go on. And you know what? My charge is to make sure to put it in pieces that are understandable so that they can get to where they want to be. Because coming back week after week and you aren't having any changes, you aren't feeling any better, your numbers aren't getting any better, it's discouraging, and they'll say, forget the whole thing. Assess physical activity levels, provide counseling, whatever it is that they want to do, come up with some suggestions with them, or let them tell you. Talk to them about getting 7 to 8 hours of sleep. And that includes naps. And if they're on CPAP and BiPAP, because a lot of CPAP there, because they're obese, make sure that they're wearing them, because that's important as well. Assess their dietary eating patterns and habits, but also giving them referrals to resources, because we know for sure that it's food deserts all over the country. And just because we're telling someone what it is that they need to eat, but they don't have access to it, then then that's not really a help to them. One of the things that they have in DC, which I'm really happy about, is they have food as medicine. So I think it's two of the Medicaid Medicaid providers, they offer food as medicine, and what they do is the physicians can write prescriptions for food that the patient should be eating, and they can take this prescription to one of the grocery stores in the area, and the grocery store will fill the prescription for the food, and the insurance company will pay for it. I know that it's helpful. And some of it had to do with the cooking too. They had the food, but didn't necessarily know how to cook it. So they've been having cooking lessons for them as well. Perform an assessment using a tool for social activity. Sometimes it may be a check-in, sometimes it may be a virtual meeting, sometimes it may be adult daycare or some of the senior programs that are in the community. And then for cognitive stimulation, it could be movies or books, strategy games, nature. It could be prayer. It could be meditation. It could be aromatherapy. It could be music, instruments, artwork. Any of those things can help support the cognitive stimulation of the patient. Um, Here is um, the website for Us Against Alzheimer's. They have a Brain Health Academy, and you're welcome to go to the Brain Health Academy. They have live courses. They also have programs that you can get continuing education for on obesity, diabetes, hearing loss, and all of them is in the context of dementia. Also, they have the brain guide. You can go and download the app that also has information for you as well. Here's the website and also the phone number. You can tailor it. It's made for a provider, but it's also for a patient so that they can tailor it to ask their physician questions. Here's some evidence-based strategies and information. And I don't want to keep you that long, but I just wanted to wrap up and say, because I want to give my colleagues a few minutes to say some things. Um, Alzheimer's is a debilitating disease. And, I've seen the person that I'm caring for, I've cared for over 5 years, and she's nothing like she was when I started to care for her. And just watching the disease progression is difficult. So now that we have some things in front of us that can put the risk, decrease the risk so that we don't have as much of it, I find that comforting. I also find it comforting that it's more research out there, and it's more people that are interested in the research out there to support um, Black and Latino populations to to get good information, to get good support, and to decrease the risk. Um, I'm going to turn it over to any questions, but if you don't have any questions for me, I'm going to turn it over to my peers so that they can talk about the most recent work from the Alzheimer's Association. Thank you.
Good evening, everybody. Missy, great presentation.
Thank you. Thank you
Um,
so much.
yes, I put in the chat for everybody. If you will go to the chat, I put in the chat, DMPs will be on the campus, and Missy is working with me on Saturday, November the 2nd. So go to the chat. The Alzheimer's Association, in conjunction with Howard University, along with Black scientists from Aging While Black, also from Johns Hopkins, Black scientists, also Dr. Stephanie Johnson, who is a Black scientist, Dr. Lauren Parker, also the Chief Diversity Officer, Dr. Carl Hill from the Alzheimer's Association, will be presenting the inaugural African American Caregivers Forum on the campus of the HBCU. And so we really want to blanket the community to know what our resources are. And so we want to push out this information. I serve as a Black nurse scientist at Eastern Virginia Medical School. I also teach at Norfolk State University and Hampton University. And so my research looks at African Americans. And I just presented at the Alzheimer's Association International Conference in Philadelphia, related to Alzheimer's research. And so this was perfect that Missy was presenting this tonight. And I worked with over 683, and I dropped that also in the chat, African Americans who stepped up and were recruited for the AHEAD study for lecanemab, which is the AHEAD study, where they are making a difference. And that study actually recruited the very first African American to make a difference. And so you can review the study and you can pull that out, or either you could email me and I'll send you the results of how we do community engaged research. And it takes Black scientists to do that. I can also send you the research that says that we need to work with our anchor institutions to do that. And it takes people like DMPs to do that. So I know we're on the screen for the first time tonight, but that's what we got to do. And I know I got some of my other colleagues. I actually served as one of your very first vice presidents of DMPs of color. So that's why I'm back tonight. And so tell me what questions you got for myself and Missy, and I'm gonna turn it back over to Missy.
While we're waiting for someone in case they have some questions, if anyone is interested in resources, I have some resources um, for caregivers. Um, that's really a big part of what it is that I like to do, because trying to manage someone with Alzheimer's disease is very, very difficult. Also, if you're interested in doing something at your church or with one of your organizations, um, I'd love to help you work with that as well. You know, in Black churches, we've done the sick and the shut-in for a very long time. That's been a ministry since before all of us were born.
Mhm.
But you know, when we have someone that has Alzheimer's, not only is the patient um, you know, secluded, also the caregiver is secluded as well. So we have to think about ways to support the caregiver. And you know, church and other organizations have a way of volunteering their time to do that. So one of the examples that I give was you know, they have somebody to come and bring the trash can to the curb once a week or something like that, or come and sit for an hour so that the person can run to the bank, things like that. Those things, those hours of time are very, very important to caregivers, because they may not be able to leave their person with everybody.
Right.
They may not be able to leave their person with everybody, or even getting out to church. Could you imagine for a minute if 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 it was somebody that would be able to sit with their person at church while they're in the service? Somebody that's trained like a nurse or something like that. You can train the parishioners to help in that way. So it is those types of things, not only the research piece of it, but the caregiver piece of it too, because caregiving can wear them down. So, but I'm open to any questions that anyone may have.
I think I saw
Hi,
somebody come
Miss.
off of
Oh,
mute.
I'm sorry. Good evening.
Good
Good
evening.
Uh,
evening.
Missy, thank you for the presentation. And for Dr. McQueen Gibson, I just had a question about speaking engagements. You say you do speaking engagements, um, different places throughout the country. If we wanted to get in contact with you to do a speaking engagement, or even Missy to do one, um, say for instance in Colorado, what would be the process?
This is Dr. Gibson. I did put my email in the chat, but let me give it to you again. Do you see it there in the chat? Let me give it. Do you see it there? Yes. So just email me, and then we can also chat. And I am a member too of DMPs of Color.
Me too.
I also and then that way and Missy's is right there too.
Hmm.
Because she also serves on the board. Give that credit, Missy.
Oh,
What's your
right.
role?
I
Missy,
do
what's your role with DMPs of Color?
I am one of the board members. I'm not one of the executive board members, but I'm one of the general board members. I do speaking for peers, so nursing, but I also do speaking for the public as well. Because I'm always really still close to the patient piece of it, just so that they have a better understanding. Because what you'll see, Dr. Latasha, is that it's still a lot of myths and misconceptions around Alzheimer's. A lot. Um, and unless we're talking about it constantly, unless we're talking about, what we have the ability to do, how we can support them, that it's a community of us that can support them, people will still believe the things that are not necessarily true.
Yes, and I think that for all of us, we need to work together, as a team. I work with DMP students, I
Mhm.
work with PhD students, and we need to support those students. I also serve as the president also of the Southern Gerontological Society, which I think is important, so that we can raise more gerontologists that look like us in our community,
Mm,
because that's going to also be very important.
right.
Because when you talked about the disparity of Black and Brown people who don't always even have cognitive screening done when they are at the PCP,
Right.
that's where the disparity starts. So again, I think that having these series that's done for DMPs, I think that that's real critical. So
And it was some work that just came out recently, even in regards to AI, artificial intelligence, that a lot of times Black and brown people aren't even prompted to be asked certain questions
mhm,
um in evaluations, which
right,
was, like for instance, hospice or palliative care.
right,
They're not even prompted to be asked about that because it's such a low rate of us that accept it. So AI was like, well, don't ask them because they don't want it. So,
Right.
I mean, that was significant to me when I saw that if it's everybody should be asked and given the opportunity to say no.
Right. So the other thing that I'm going to do really quickly, because I know that we're at the bottom of the hour,
Mhm.
that if there are other questions, if people can, again, we do want people to complete the evaluation that is in the chat. So that piece needs to be completed. And the other thing is that because I'm also a clinician, I do see patients as an advanced practice nurse. So I am also going to put my clinical email. I see patients also as an advanced practice nurse. I see patients in clinic every Thursday and Friday. So I just put that email in the chat also. So you can either send email to my clinical site or either to my academic site. So you can reach out to Missy and myself at either site. But we do want you to complete the evaluation that is up a little bit higher because we want to complete that piece. And then we want to open up the screen site one more time for questions because we have to do that as DMPs of color, right, Missy?
Correct.
There we go. And then I thought I saw Miss Linton, Dr. Linton on the screen. Are you still on the screen, Dr. Linton?
She's not. She had to go pick up her child.
Oh, okay, there we go. All right. So while people are completing the evaluation, because I'm just gonna jump back in as a former executive board member, do we have any other questions? The other thing that I always remind people too, if you have a local Alzheimer's association in your area, they have a great Purple Power program, which actually helps to address Alzheimer's in the African American community. And that will also be something that you may want to take advantage of. And if you email me, I can even send to you. They have some great fans that actually say Purple Power. And on the back of the fans actually have the 10 warning signs of Alzheimer's, which are pretty cool for you to have in a church. And people love those because they are culturally sensitive. And I love those when I go to a church because people go, because you know how they love fans in the church and they usually come from the funeral home. But when they actually come from the Alzheimer's Association and instead they're not coming from the funeral home, they keep them around a little bit longer. So again, that's another tool when you partner with your Alzheimer's Association. So they've been trying to work with those a little bit more in our community. So that's another tool that is very helpful also. So I'm glad that we were able to open that conversation tonight to talk about that a little bit more. And then also there was a great article in the Essence magazine 2 months ago that was actually authored by one of my colleagues, Lauren Parker, who's going to be at the event that Missy and I are going to be doing on the campus of Howard University. Lauren Parker, that article that actually had Wendy Williams on the front, it talked about the disparity of Alzheimer's dementia. And so she again will be talking about why there is a disparity in our community. So the disparity, what happened to Wendy Williams was unfortunate because of drugs and alcohol, but also part of it was the diagnosis too late. So it's a little bit of everything. So I'll let you summarize, Missy, and I'm gonna get off the screen and say goodnight to everybody, and I'll let you finish up.
In summary, I want to thank you all for joining us. Just to let you know, there's plenty of resources out there. You can feel free to reach out to us and we'll help you in any way that we can, whether it's for our peers or whether it's for the community. We have plenty of tools in our toolbox to support our peers and our community to have better Alzheimer's care. Thank you and good night.
Good night. And on behalf of the DMPs of Color Programming Committee, we would like to thank everyone for joining, and also in absence of our founder, CEO, Dr. Danielle McCamey, who wasn't able to attend tonight, but gave great, I would say, advertisement of this event and encouraged us to attend. So once again, we thank you for attending, and everyone remember we have our conference coming up in October. So I hope to see everyone not in the little square boxes anymore, but actually in person. So everyone have a good evening. Thanks again for attending. And Dr. McQueen Gibson and Missy, I will be in touch with both of you. Good night, everyone.
Thank you. So long.